Welcome to the demonstration for the denture teeth setting. So before we start, of course, we need to have your tools, we need to have your carvers, like this one, and like this one, this is a beaver tail carver. Okay, so it's called beaver tail because it resembles the tail of the beaver, right? Okay, so when you are setting teeth, okay, a good technique that I usually do is to place masking tape onto the areas wherein the wax can flow into. Okay, so this technique saves you a lot of time cleaning up your work. Okay, especially in the practical exam or in the board exam. Okay? You are under time pressure. You can save a lot of time. When cleaning time comes, you just have to peel off the masking tape, right? So that's the technique for you. When we are setting teeth, okay, denture teeth, the first thing that you should make sure is to seal the denture bases on the cast, okay? So you are not supposed to set denture teeth that are not on denture bases that are not sealed, okay? So you hit your carvers and take your pink wax and then let it flow onto the cast into the denture base so that we will have a very stable foundation for our setup. Okay, so do that all over and be sure that it is stable and not moving around. Okay, so once you've done that, check the sisal pin also that it is in place. Okay. Now we are ready to set. Okay, when we are setting the denture teeth, first thing to do, of course, is to try to heat up the wax in the area wherein we want to set the denture teeth. Okay, so we do that by heating up our carver. In this case, we're using a beaver tail carver and trying to carve out the wax on that area. Okay, and trying to melt also the wax on that area. Okay, once you finish carving the appropriate size of the wax on that area, you can already place your denture teeth. Okay, so for this one, we're placing central incisors. Again, remember that the central incisors, the incisal edges of these denture teeth are actually placed in the level of the OCR, right? You can also use your carvers to adjust the setting accordingly. Okay, so be sure that you are in the correct plane following your occlusion rims and also observe the level of the incisal edges. Okay, so once you have that, you can try to seal the setting, okay, by using your carvers, hot carvers, and try to melt or scorch the wax on the sides of the denture to seal it off. Okay, once you're satisfied. Okay, also at the bottom, you can also seal it, right? As you can see, we're setting there. Okay, now again, just a reminder, okay, the central incisors are set following the line of the OCR, the incisal edge of the OCR, okay, and once you actually place it correctly, okay, the natural contour of your denture teeth will take care of the angulation, which is straight or slightly going to the distal. Okay, now you do the same for the lateral incisors. You melt the wax on the area of the lateral incisors. Okay, make sure that there is adequate space for you to place your lateral incisor. Okay, then place it accordingly in the OCR, following the contour of your OCR. Okay, as you can see, there are some melted wax that are overflowing to the denture teeth. Please be sure to remove them because this will cloud your judgment on the appearance of the teeth. So it's very easy just take your carvers and then try to melt them also. Alright? Melt the wax. Again, the lateral incisors are set half a millimeter or 0.5 of a millimeter above the OCR or above the central incisors. Okay? So once you clean that up and you have a better view, see, I think this is more inclined to the mesial, especially at the neck area. So what we would like to do is to take your carver and then try to push it onto the proper position. Okay, so a little distal. On the lateral view, you can see that the central incisors, the facial is straight, and the neck of the lateral incisors are actually in, right? More lingual. So check also on the setting. Looks okay. Looks correct. Again, the central incisor is flat, and then the lateral incisor, the neck is more towards the labial, or actually lingual. Sorry. Now we are ready to set the canine. Again, the canine, as you can see here, is directed, especially the roots are directed towards the distal. Okay. Now we place the canine onto the OCR. So I think this is also a little bit towards the mesial. So no problem. We melt the wax on the distal portion to create the space. Okay, and then is the trick. We melt the wax on that area so there will be space, and then try to push it, okay, on the neck area. Alright? So there you go. Again, you can see the canine should mimic the anteriors, the mesial part should mimic the anteriors, and the distal part should mimic the posteriors, because this is the turning point of the occlusion. Okay, again, the canine, just a reminder, has two planes, right? The mesial plane mimics, again, the anterior teeth, and then the posterior, or actually the distal plane, mimics the posterior teeth. So this is the cornea, right? So you can also see that on the label. Now, for the lower, again, just like the upper, you just carve up the wax and then try to place your central incisors. The central and the lateral incisors of the lower are almost at the same level, right? So they have a straight curvature, okay? Then you check for the contact. Again, there should be no contact between the upper and the lower anterior teeth, right? So the contact should be absent, right? So you should have 1 to 2 millimeters of overjet and overbite between the upper and the lower anteriors. Okay, so please observe that properly. And also the horizontal overlap. Let me remind you that if you fail to do this, if you have contact on the anteriors, it's a big deduction on your grade. Okay, once you're finished with that one, you're satisfied, you can now set the canine. Again, for the lower canine, be sure that the distal portion of your canine is pointing towards the crest of the ridge or the neutral zone. And then you can place the posterior teeth starting with your first premolar, again following the crest of the ridge. So all of the premolars and the posterior teeth, the central fossa should fall on the crest of the ridge or the neutral zone. So again, you can set the second premolar already, and then the first molar, you can already place it also, following the correct location, also the second molar. Okay, once you're satisfied, you can use a ruler or any straight device to check if the central fossa are in the correct position, and then you can clean the occlusal surfaces, right? It should more or less look like this. Okay, now for the upper, you just melt the wax and place the uh, denture teeth, and then you try to occlude. Okay, more or less should look like this. The buccal cusp of the upper, falls on the mesobuccal group of the lower first molars. Okay, so you have to review your occlusion. Be sure though that the lingual cusp or the functional cusp of the upper should fall on the central fossa of the lower. You can also expect this on the premolars, right? So they should fall on the embouchure areas of the opposing teeth. Okay. Now also for the other posterior teeth should be the same. Okay. So we expect you to have this kind of setting more or less for the posteriors. Okay. Now should have a very clean setup. Okay. Clear out all the waxes that were overflown, and your mountings should look like this. Okay, very clean and very organized. Okay, so I hope you can do this on your own. Okay, I'm sure you can do it. Thank you.
So what, we get drunk, so what, we smoke weed, we're just having fun, we don't care who sees. So what, we go out,
hey, let me get a lighter,
that's how it's
please.
supposed to be.
Cause you know I'm high as fuck and I forgot one. Keep that in there.